I start. My topic is about multiple sclerosis. Multiple sclerosis or MS. Introduction. We talk about brief overview disease of disease condition, history of multiple sclerosis, and
So put on the
epidemiology.
slideshow, no? Slideshow.
Ramin.
Hello, Ramin.
Yes, yes. What happened?
Make it slideshow. Make it big screen.
Just a show. Isn't this a screen?
Come in.
What's up?
Introduction, Ramin.
Hey, big screen.
Just big screen.
Let's stop here.
Now it's okay?
Okay. Yes, it's okay.
No. Make it big
نه نه
screen.
صفحه بزرگش کن.
الان بزرگ
کلا
شد.
بقیه‌اش همه سیاه باشه. نه همون کنار زوم هست تا اون مانیتور.
الان همین کارش
که
کرد.
آخریه.
زدم.
آره همین.
You stop recording now. No need to stop record now.
Topic is about multiple sclerosis and the introduction. We talk about brief overview of disease condition, history of MS, epidemiology, type of multiple sclerosis, signs and symptoms, factor causing disease, diagnosis, treatment, and okay. Introduction. Multiple sclerosis is a neurodegenerative disorder of the central nervous system that include the brain, spinal cord, and nerves. It is an inflammatory and demyelinating disease. Inflammation. Body's own immune cells attack the nervous system. And the myelination. Myelin is a protective covering of nerves. Myelin is destroyed, leaving multiple areas of scar tissue or sclerosis. It is progressive disease. History of multiple sclerosis. The earliest description of multiple sclerosis was recorded in Holland on August 4, 1421. First clear clinical description of disease beginning to appear in 1838. The first actual case was diagnosed in 1849. Okay, epidemiology of multiple sclerosis in India.
Your slide is not changing.
Ramin.
You should ask no every time to your presenter next slide, then he will change. Which slide you are there? You.
In my laptop is changing.
Now it is changed here.
How it changed?
Look at the screen and then do.
Okay. Now it's okay.
Worldwide.
Yeah, it's okay now.
Worldwide occurrence: 2.5 million case, rough estimate prevalence of 5 to 10 per 100,000 individual in India. MS in women is 2 to 3 times more prevalent than in men. Average age at onset is approximately 25 to 13 years. Sorry, 30 years. Mean 27 years. It is not contagious. Features of MS in India are similar to those seen elsewhere. Okay, multiple sclerosis type.
Change the
There
slide,
are
Ramin.
type.
Go ahead.
There are 4 types of MS or multiple sclerosis. Relapsing remitting multiple sclerosis or RRMS. Primary progressive multiple sclerosis PPMS. Progressive relapsing MS or PRMS. Secondary progressive multiple sclerosis SPMS. Relapsing remitting MS. More than 80% of the case. Define clinical exacerbation of neurological symptoms, followed by complete or incomplete remission during which the person fully or partially recovered from the deficit acquired during relapse. PPMS or primary progressive multiple sclerosis. 10 to 20% of individuals with MS are diagnosed with primary progressive multiple sclerosis. Gradual progression of the disease from its onset, and no overlapping relapse and remission. Progressive relapsing MS, PRMS. This type is rare, initially presenting as a primary progressive multiple sclerosis. During the course of the disease, the individuals develop true neurologic exacerbation. Study progression of clinical neurological damage with superimposed relapse and remission. And the last type is secondary progressive multiple sclerosis or SPMS. Characterized by a steady progression of neurological damage with or without superimposed relapse and minor remission. And individuals with have experienced a period of relapsing remitting multiple sclerosis which may have lasted from 2 to 40 years. And superimposed relapse and remission fade over time. Multiple sclerosis signs and symptoms. Vision impairment, tingling and numbness of the skin and limbs. Difficulty with walking, weakness, urinary and bowel problem, depression, and memory loss. Okay. The symptom of multiple sclerosis may occur in isolation or in combination. A clinical attack is considered if the symptoms are present for a minimum of 24 hours. Okay. Effect on the body, multiple sclerosis, effect on the body. On the brain is fatigue, cognitive change, depression, dizziness, and vertigo. Hormonal effect, frequent urination, incontinence, and difficulty walking, blurred vision, temporary blindness, seeing dark spots, numbness, pain, constipation, diarrhea, sexual problem, muscle weakness, stiffness, and spasm. Factors contributing for MS. Genetic factor, gender, family history of multiple sclerosis, environmental factors, infections, socioeconomic status, and migration. Gender. Women are 2 to 3 times more likely to get the disease. Family history of MS. Family history increases the risk of developing MS. Environmental factor. Multiple sclerosis occur most commonly in those living in northern climate. Infection. Researchers believe that many autoimmune diseases are provoked by some kind of infection that restrict people who have a certain genetic makeup and socioeconomic status. Less common in rural and lower class. Migration. If you move before that the age of 50, your risk 15. Your risk is that of the people in the country you move to. If you move after age of 15, your risk stays fixed at that of the country you grow up in. Multiple sclerosis causes. The exact cause of multiple sclerosis is not clear. In MS patients, a higher number of immune cells is seen, which suggests there may be an immune response can be due to a virus or genetic defect. Other causes are environmental and genetic. Environmental and genetic. Multiple sclerosis diagnosis. MS is a clinical diagnosis. It is diagnosed by neurological examination and brain MRI scan. Family history and lumbar puncture are also used for diagnosis. If multiple sclerosis is present, very high percentage of protein IgG. IgG bands can be seen in spinal fluid, which is an additional confirmatory test. How does it work? This peak is a normal condition of myelinated nerve fiber. Nerve impulses like this. Node of Ranvier from one to another. Okay. The myelination of nerves fiber in multiple sclerosis. This peak is demyelination of nerve fibers in MS. Nerve impulses like the destruction of the myelin sheath lead to impaired communication between nerve cell and neurological symptoms such as abnormal sensation, vision problem, and weakness. Mechanism of action or mode of action. And the immune system attacks axon, causing destruction of myelin sheath, resulting in a conduction block, which lead to permanent loss of function. This is pathophysiology. Autoimmune response results in damage and loss of fiber. Nerve can regain myelin, but process is not fast enough to avoid the damage that occurs. Inflammation, loss of myelin and nerve fibers, and the scarring that follow resulting reduced transmission of nerve signal within the CNS, central nervous system. Type of symptom and severity vary widely due to the location of scar tissue and extent of demyelination. Treatment of multiple sclerosis. Although no cure exists for multiple sclerosis, treatment aim to reduce the number of attacks and to lessen their severity when they do occur. Medication, chemotherapy, MRI, using a three-dimensional image that determines whether a patient's condition is worsening. Treatment of acute relapse. IV methylprednisolone is first-line therapy. 1000 mg daily for 5 days without an oral topper. 2 hours onset of effect, peak by 12 hours. Few side effects is mental status change and psychiatric. This is second line therapy. Second line therapy is plasma exchange. 5 to 7 exchange recommended on every 2 days. 30 to 50 ml kg weight who don't respond to glucocorticoid. Medication used for multiple sclerosis. Symptomatic management in MS. Spasticity. Baclofen, tizanidine, dantrolene, diazepam, optic neuritis, methylprednisolone, oral steroid, fatigue, antidepressant, amantadine, pain, codeine, aspirin, depression, duloxetine, and escitalopram. DMD or disease-modifying drug. And interferon beta 1A, Avonex, and Rebif. Protein that is a replica of human interferon. It suppresses the human immune system and help to maintain the blood-brain barrier BBB. Avonex injected into muscle once a week, and Rebif is injected under the skin 3 times a week. This drug is useful to people who have a definite progressive MS. One side effect of the drug is flu-like influenza symptom. And other medication, DMD, disease-modifying drug, is interferon beta 1B, beta seron. Different from our own interferon. This medication does same thing as beta 1A, but is injected just under the skin every 2 days. This is also given to people who have a definite progressive MS. Side effects include irritation and redness at the site of injection and flu-like symptom, influenza symptom. Drugs available in India. Interferon agent is interferon beta 1 B betaferon. Interferon beta 1 A agonist. Interferon beta 1 A revive glatiramer acetate and natalizumab and mitoxantrone. Okay. Dose for interferon beta 1 is 250 mg is SC subcutaneous every other day. For interferon beta 1A is 30 mg intramuscular once a week. For interferon beta 1A is 44 mg under skin SC3 weekly. For glatiramer acetate 20 mg under skin once a day. And natalizumab is 300 mg IV once monthly. And then is 12 mg IV in every 3 months. And side effect for first drug is flu-like symptom or influenza symptom, depression, injection site reaction, leukopenia, neutralizing antibody. For that too is as above. And for glatiramer acetate is injection site reaction, transient flushing. This. Thank you. Finish.
Okay, that's all.
يعني
Anybody have any question to her?
There is something called as pre-medication therapy before giving interferon. If you can explain, it will be good. Right?
Do you know, sir, about that?
Sir. Little I know,
Sir.
but I thought you were.
I'm asking Sahar.
Yes.
Do you know about pre-medication before starting interferon?
No, I don't know.
Okay, sir. Share it.
Shall I stop the recording?
Sarat?
Hello, sir.
Yeah, you can share what you know about pre-medication.
Like before starting interferon beta 1 or any interferon, it can cause flu-like symptoms, side effects. So we have to give acetaminophen and antiemetic before starting the interferon therapy, just to avoid flu-like symptoms. This is
Everyone got it?
Which drug, Sharad?
Interferon.
Before giving interferon?
We have to pre-medicate the patient with acetaminophen. I mean paracetamol. Like can cause flu-like symptoms like fever, chills, malaise, everything will be there. Once we start interferon.
Because flu-like symptoms very commonly adverse side effect.
Yes, sir. And it can cause thyroid dysfunction after long-term use. Because as it is given for chronic therapy, not for acute attacks, it can cause. It can produce thyroid and autoantibodies. So TFT should be monitored frequently.
Yeah, and when you present treatment, no, at the same time, like this monitoring parameter, like if this drug, patient is not suitable to receive this drug, what alternative? And like treatment part, you need to focus more. Okay, multiple sclerosis you did, but This looks like more of theoretical and not oriented to therapeutic part much. Okay, so try to twist your presentation in that way, this for everyone, so that it becomes practice oriented rather than just theoretical. Okay.
No, so many drugs now, which is the drug of choice here?
Yes, sir. Question to you.
Sir,
Which is the drug of choice? Which is the first drug this may start?
Sorry, sir.
Yes,
Voice
there
is
is
not properly. My internet has problem.
actually for acute attacks, prednisolone, high dose corticosteroids are the choice here. For chronic therapy, interferons and biologic therapy.
Okay. Yes, sir.
See, you should do thorough presentation. You should know everything, because all people are here. You should expect that any kind of question you will be asked. We have given you liberty. Okay, you don't need to restrict only case presentation or only a particular drug or only any journal or article. You can do anything, but you should be thorough about that. Okay, to everyone, so that try to make it interesting. It is being recorded. We are